We're here with Jason Baker at the 21st Conference on Retroviruses and Opportunistic Infections, and he is from the University of Minnesota and also from Hennepin County Medical Center. So we really, we bring science to people here, and it's always complex. But we're going to try to take a little bit of that edge of science off and make it a little more real and talk in more real terms, because what you're doing is really important. And what a lot of people are doing is really important. But here we're trying to tease something out. It's about the coagulation factor that we're dealing with here. And you did the research. You have a scientific panel, a poster, which outlines it very scientifically. But we're going to translate that a little bit into, and more generally, like you said, I think that would be helpful if we can more generally explain what that means.
Sure. Thanks for having me, Fred. Mm-hmm. So I think, it's to the framework that's helpful to sort of think about this research is that we know that the therapies for HIV are very effective, but one of the things, there's a couple sort of issues that are persistent once people get on effective treatment. And one of the issues is that the immune system still has some abnormalities that persist. And there's a lot of interest to try to figure out why those abnormalities persist, if it's damage that occurred prior to treatment or if it's ongoing damage. But one of the aspects is that the immune system's a little more activated. Sometimes you hear the term immune activation. And then as a consequence of that and other factors, there can just be these what we call cytokines, or different sort of markers that are called inflammatory markers, or sort of stimulate the immune system body-wide, systemically. And a lot of times they're very nonspecific. In the short term, they're very a good adaptive response for our bodies, but at a low level over many years, which is sort of what we're observing now, there's a lot of consequences for that. And I think you're talking a lot about that in this in some of your sessions. But what we specifically were trying to sort of understand better is how that interconnectedness relates to the coagulation system. And when the immune system is activated, or we call this inflammation, your body, the coagulation system in your body is tightly linked to that. And again, it's a very adaptive thing in the short term. If you were to cut yourself, you want your blood to clot, right. So that stops. But at a lower level, over many months or years or longer, we're not seeing a lot of sort of big clots in the body, but the coagulation system seems to be a little more revved up. The propensity to form clots, and trying to understand how that coagulation biology is changing. And then the second step is how does that explain a disease risk that we're seeing? Greater risk for not just sort of heart disease, but other kinds of illnesses that seem to be happening when this is going on for many, many years. And so we're trying to understand how the coagulation system is being changed by inflammation.
But you really, when you look at the blood of an HIV positive person versus someone who isn't, it looks different. You can look at it.
Yeah, you can look at blood markers that reflect the degree of coagulation. You can call it, clotting. Like I say, we're not seeing in large blood vessels clots, but there is evidence that at least on a low level, the blood is tending to want to clot more, and it's downregulating itself to some degree. But I don't think we have a great understanding of how that's causing a problem. But over many, many, many studies, it seems to show that when these clotting markers are up in certain patients, those patients have more diseases over time. And so understanding how the system is perturbed in the context of HIV, and then how that's leading to disease, I think is really the focus of a lot of the work that's going on in the coagulation system.
And then maybe if it is causing disease, or how it is causing disease, we then have to figure out how do we prevent that.
Yeah,
so
or can we mitigate it?
Yeah,
and can we mitigate it in a safe way? Because as you know, people are doing much better and having very sort of successful recovery of a lot of the immune deficits from just antiretroviral therapy. So we really don't need drastic treatments that are going to bring their own new toxicities. Right. We really want safe, effective treatments. So it's going to be a challenge. You have to understand this complex biology and also mitigate it in a way that's pretty safe, because people are generally doing pretty well.
The body kind of tries to fight. It kind of tries to have its own multiplicity of defenses and so forth. But here maybe we just need a little bit of a push. We need to do anti-inflammatories? Is there some, we talked about exercise and nutrition. There's maybe a whole host of things that people can do if they want to really, generate a change.
Yeah,
at least in the meantime.
I think, it makes sense if we think that the immune system abnormality or inflammation is driving some of these coagulation troubles, that if we have an anti-inflammatory, we might, that's speculative. We haven't sort of haven't connected those dots well yet. But certainly I think things like aspirin, or there's lots of other medicines that are safe that could be tested in this regard. I think are being tested. There's a nice little study that I just actually saw presented about brisk walking for an hour.
Right, we did that.
Yeah,
we did that interview.
Yeah, I mean it's a great little proof of concept study. I mean it's small, but it reinforces that even though there's unique features in the context of HIV, we know an exercise decreases inflammation in all sorts of other contexts. But just to show that, there may be unique features about HIV, but at the end of the day, it's biology. Yeah. It's the same biology, so no matter why it's perturbed, sometimes these simple things are really effective.
The body is meant to be used and used properly and safely, and putting things into that are good and not things that are bad. No smoking. I mean, all of these things add to the either the detriment or the benefit of the patient.
Yeah, I mean, sometimes you can make it more complex than it needs to be. We do know a lot of simple things that work well.
But
avoiding toxins and cigarettes and exercising, pretty effective.
Profound.
Pretty effective.
Then we try to tease little things. But I think the research you're doing is really good. We have to know all the pieces and then how they fit. And do you have any next work that you're going to be doing, or do you have a sense of where you're going next?
I mean, specific to the sort of coagulation story, I think it's those tiers of understanding how it's perturbed and how that causes disease, and at the same time or after that, how can we mitigate it with treatments that are safe?
Design other trials that will be kind of down that same path?
Yeah, basically around that same path, and you can actually, by testing safe interventions, learn about that causal pathway as well. So, those are the types of things we hope to. It's incremental knowledge gains, but.
We'll see you in another couple of years, and you will be making a presentation, and you'll have learned a lot more, and we will be ever so more informed.
Thank you, Fred.
Thank you very much, Jason. I appreciate it.